When we think about cancer, we often imagine it affecting areas like the skin, lungs, or breast. But did you know that cancer can affect the eyes too? Although eye cancer is rare, it's a serious condition. According to the American Cancer Society, about 3,000 people are diagnosed with eye cancer each year, and approximately 500 lives are lost to it annually, making it one of the deadliest cancer types. In this video, we'll cover everything you need to know, from early warning signs to treatment options that could make a life-saving difference. Let's begin with an overview of the different types of eye cancer. Each type affects a different part of the eye, which means the symptoms can vary quite a bit depending on where the cancer originates. Although it may sound technical, we'll keep it simple and easy to understand. One of the most common forms of eye cancer in adults is called intraocular melanoma. Now, most of us think of melanoma as a skin cancer, but it can actually develop in the eyes too. Intraocular melanoma starts in the cells that produce pigment, melanocytes, which give your eye its color. The cancer typically develops in the uvea, a middle layer of the eye rich in blood vessels, but it can also appear in the conjunctiva, a moist tissue covering the front of the eye and inside of the eyelids. Symptoms for this type can sometimes sneak up on you, but people with intraocular melanoma may notice blurry or reduced vision, dark spots on the iris, or unusual changes in pupil size. Other signs include floaters, little spots drifting across your vision, or even a bulging effect in the eye if the tumor grows larger. Another type of eye cancer is intraocular lymphoma. This rare cancer often affects both eyes and can sometimes appear alongside central nervous system lymphoma, a form of cancer that affects the brain. While intraocular lymphoma can be slow to develop, it often causes discomfort, such as eye redness, pain, and blurry vision. Sensitivity to light is another major sign, as well as the feeling that there are floaters in your field of vision. For children, the most common form of eye cancer is called retinoblastoma. This cancer primarily affects children under 5 and occurs in the retina, the light-sensitive part of the eye that sends visual information to the brain. Sometimes, parents may first notice retinoblastoma by taking a photo of their child. Instead of the usual red eye reflection, the pupil may reflect white in the photo. Other warning signs can include crossed eyes, unusual eye swelling, excessive tearing, or a sudden sensitivity to light. There's also a rare childhood cancer called intraocular medulloepithelioma, which mainly affects children between the ages of 2 and 10. Medulloepithelioma typically affects only one eye and starts in the ciliary body, a part of the eye responsible for focusing. Symptoms can resemble those of other eye cancers: a white reflection in the pupil, increased tearing, and a sensitivity to light. Finally, there's squamous cell carcinoma, a cancer that usually affects the skin but can develop on the surface of the eye, particularly in the conjunctiva. While it's rare, this type of cancer often starts as a bump or small growth on the eye's surface, which can lead to a persistent sensation of something in the eye. Redness, discharge, or swelling may also appear, and people with squamous cell carcinoma might notice a visible lump or bump on their eye. While symptoms can vary depending on the type and location of the tumor, there are several common signs that may appear with most forms of eye cancer. Before we take a closer look at the signs that could signal something more serious, hit that subscribe button and leave a like on the video. Thank you, it means a lot. 1. Vision changes. One of the most noticeable early signs of eye cancer is a gradual change in vision. You might experience blurriness, fading vision, or a darkening of sight in one or both eyes. 2. Dark spots or growths on the eye. Unusual spots or changes in the eye's appearance, especially in the iris, the colored part, can be a red flag. These may appear as dark patches or new areas of pigmentation that weren't there before. 3. Eye floaters. Floaters are tiny specks, shapes, or strands that seem to float across your field of vision. For many people, floaters are normal and harmless, especially as part of the natural aging process. However, a sudden increase in floaters or the appearance of larger, more noticeable shapes may indicate eye cancer. 4. Persistent eye, redness, and discomfort. Redness or irritation in the eye is usually temporary and may result from lack of sleep or minor irritation. However, when redness and discomfort persist or even worsen over time, it could point to something more serious, like a tumor affecting the blood vessels or tissues inside the eye. 5. Sensitivity to light. Increased sensitivity to bright lights or sunlight, known as photophobia, can sometimes be an early indicator of eye cancer. This heightened sensitivity can feel uncomfortable, even painful, especially in environments with strong lighting. Now, these symptoms don't necessarily mean you have eye cancer. Many of them can be associated with less serious eye conditions. However, if one or more of these symptoms appear suddenly, increase in severity, or do not go away with standard treatments, it's important to consult an eye care provider for a thorough evaluation. Let's take a look at some of the most common treatments. Radiation therapy is a standard treatment option, especially for tumors that are localized and small to medium in size. In this method, a machine directs radiation at the tumor from outside the body. Patients usually attend several sessions over a few weeks. This approach is often used for larger tumors or those located deeper in the eye. Laser therapy is another option. This treatment uses highly focused beams of light to destroy cancer cells, making it a targeted and effective choice for certain types of eye tumors. Laser therapy can be especially beneficial for small, localized cancers and may be combined with other treatments for enhanced effectiveness. In some cases, cryotherapy, also known as cold therapy, is a suitable treatment option. This approach involves applying extreme cold to cancer cells to destroy them. Cryotherapy is particularly effective for tumors on the eye's surface and can work well alongside other treatments, especially in treating conjunctival cancers. Another common treatment option is chemotherapy. For eye cancers, chemotherapy can sometimes be administered directly into the blood vessels supplying the eye, or given as a standard intravenous IV treatment. This option is most effective for types of cancer with a high likelihood of spreading, such as intraocular lymphoma, which often affects both the eyes and brain. In some cases, surgery may be the best approach. Surgical treatments can range from removing just the tumor to, in severe cases, removing the entire eye. Although the idea of surgery can be scary, it's often a valuable option when the cancer is aggressive or advanced. Preserving vision is always a priority, and eye specialists carefully assess the benefits and risks to determine the best approach for each patient. Remember, keeping an eye on your vision isn't just about seeing clearly. It's about staying healthy and catching any potential issues early. So the next time you notice a change in your eyes, take it seriously. It could be a small symptom that saves your sight. Thank you for watching. If you're craving more wellness wisdom, make sure to leave a like and subscribe to the channel for weekly uploads.